The Baby Friendly Hospital Initiative is a program launched by the World Health Organization, that's WHO, and UNICEF in 1991. So the purpose of the BFHI, as we call it, is to put everything in place in hospitals so that babies can be fed in the best possible way, starting from birth. So what PAHO and WHO recommend is that babies should begin breastfeeding within the first hour of birth. They should be exclusively breastfed for the first 6 months of life, and then after that, other foods will be introduced, but breastfeeding will continue up till 2 years and beyond. The Baby Friendly Hospital Initiative is based on 10 steps that the maternity facility has to implement in order to make sure that everything is conducive for breastfeeding before the baby leaves the hospital.
Southern Regional Health Authority, as a statutory body to the Ministry of Health, we are committed to this commitment. And so therefore, our commitment is that all our 5 hospitals will become baby friendly within the next 5 years. At present, one of our facilities is certified as baby friendly, and this Mandeville Regional Hospital is the second one in line, which will happen within the next few months. Being baby friendly means that all 7,000 of the babies who deliver within our hospitals each year will, on discharge, be able to receive full breastfeeding for at least 6 months, and their parents and mothers will be well equipped to be able to carry the process on.
PAHO has been helping in training the hospital staff. We have been providing what we call the tools, which are the resources for the Ministry of Health and the National Infant and Young Child Feeding Committee for them to implement this in as many maternity facilities in Jamaica as possible.
We do clinical training for the clinical staff, the doctors, the nurses, all the professional groups. And we also do what we call non-clinical training, where we train the staff that are the groundsman. Just about everybody must be trained. So the clinical training takes 20 hours, so it's 3 full days of training.
WHO and UNICEF have prepared materials. There is a 21-hour course that they have recently updated, and that is used in training health workers so that they can have the skills and competencies so that they can help mothers in their work in implementing the Baby Friendly Hospital Initiative.
We want to implement what is called the 10 steps to successful breastfeeding. So all the staff will have to be trained in the 10 steps, and they will have to be practicing the 10 steps to successful breastfeeding, because that's what really makes the facility baby friendly. We also source materials, information, IEC material for the pregnant women, because in the clinics they're given their printed material as well as their education in terms of group education. So we source those from the region at the regional level, and we distribute to the facilities so that they can have them for the pregnant women when they are in the clinics and they are being educated, and also when they are discharged home. We call it discharge brochure. They'll be going home with information so that can help them in order to successfully breastfeed their babies.
Jamaica has done significant work in implementing the Baby Friendly Hospital Initiative. Initially, Jamaica had 10 institutions providing maternity services certified as being baby friendly. However, in 2010, following an external assessment, it was found that those institutions no longer met the standards. And so a lot of work has been done in strengthening the framework for the implementation of the Baby Friendly Hospital Initiative, including the establishment of hospital, infant, and young child feeding committees, the training of healthcare workers across the institutions providing maternity care in Jamaica, and establishment of nutrition education rooms, just to name a few. In addition to that, in support of the implementation for the Baby-Friendly Hospital Initiative, Jamaica has a national infant and young child feeding policy, which has been approved by Parliament. And within that policy, the Baby-Friendly Hospital Initiative is integrated.
It is very important to the hospital, firstly in terms of the training that has been made available to the staff and building the skill set of the staff to deliver the information that is important to help our mothers. This training will help in highlighting to our mothers the benefits of breastfeeding. It helps the hospital, yes, in terms of its building its systems to be able to deliver the training so that persons are able to learn and utilize this knowledge in their everyday life. Secondly, it will help our patients, the mothers in particular and the babies, in terms of giving them the information that will allow them to ensure that our next set of adults are healthy adults, right? And possibly even before getting there, it will ensure that our babies are healthy and that the need for them to have to come to hospital for health care is at a minimum, if not nil, right? So we'll have healthier babies, healthy community, healthy nation.
Breastfeeding is done because when a baby is born, within half an hour after birth, breastfeeding is initiated. How that is done, when the baby comes out, within 5 minutes after birth, the baby is placed on mommy's tummy, right? And so baby's naked, mommy's tummy is exposed, her tummy is also naked, so you have skin to skin taking place there. In that way, the baby can crawl up to the breast and breastfeeding is initiated. And that is done, all of that is done within the first half an hour after birth. And then that contact is maintained for at least 1 hour. Mothers, they have an opportunity to be observed when they are breastfeeding. And if they're not doing well at breastfeeding, then they're referred. We have some special persons on the ward, and we never used to have them, but since about 2 years now we have them. They're called community health aides. Instead of working in the community, they work on the ward. So these community health aides now, they will go and assist the mothers and whatever shortcomings the mothers have. After they, the community health aides, observe the mothers breastfeeding and see the gap, they will try to fix them or help the mothers to overcome those gaps.
I had a wonderful experience having my baby here at Mandeville Regional Hospital. The service from the nurse, it was wonderful and it was hands-on. This is my fourth child alive, and out of all of them, I've been taught more by the nurse. You see more person telling you about breastfeeding, you teaching you, it is more hands-on. They show you how to hold the baby, the different positions that you can hold the baby, how you can store the breast milk, how to take care of the baby after birth, and stuff like those.
So it is hoped that with the increase in the exclusive breastfeeding rates, we'll see a decrease in illnesses and death from infections and NCDs.
Across the region and around the world, we have found that the hospitals and other types of maternity facilities that have implemented the BFHI, when babies are born in those hospitals, it's likely that they will breastfeed longer, or that the mother is less likely to stop them breastfeeding at an early age. So yes, it is successful in increasing breastfeeding rates.
We have established parish infant and young child feeding committees in each parish, and these parish committees have the responsibility of monitoring the Baby-Friendly Hospital Initiative and providing support to the institutions in the parishes.
It's important that each facility that is baby-friendly, that they do monitoring. So they will monitor the processes to ensure that the 10 steps to successful breastfeeding is being practiced. Because though you may be certified baby-friendly, every 3 years it is recertified. So you have to ensure that you keep up the practices in relation to ensure that the breastfeeding is what is promoted, because the aim is to ensure that every baby that is born in the facility is given breast milk. So that's the best milk, and that's the milk that we promote. But the 10 steps to successful breastfeeding must be maintained at all costs in order to maintain your baby-friendly certification status.
In programs such as this, you have to reassess. You have to make sure that the program is in fact doing what it should be doing. And so this last assessment was done in 2017. The WHO looked at how the BFHI was being implemented and what could be done better. And one of the things that was done, and this was a major change, was the changes to the 10 steps to successful breastfeeding. So the 10 steps were reviewed, tweaked a bit to make sure that, yes, they are in fact what a facility needs to be doing. The wording on some was changed, some additional parts were added to others, but overall, it is still 10 steps that the maternity facility needs to fulfill in order to be fully baby friendly.